Vandame, we can start.
Yes, we can. Okay. So today we will talk about Praksha therapy for asthma management. So that lecture was due. So I will cover first my due lecture, and then we can discuss if something is not clear in any topic which we have covered in the last week. Okay, so today's topic is Praksha therapy for asthma management. In this particular talk, we will focus on particular postures and breath work to enhance lung capacity, mudra, hand gestures to influence pranic flow or the flow of vital energy inside the body. We will talk about some mantras too. They are sound vibrations for mental and autonomic balance. And there are certain meditations, for example, mindfulness to reduce stress and inflammation. And there are certain other spiritual practices like non-violence, breath awareness, and spiritual purification. So first of all, we have to understand how asthma changes the normal function of our body. So we know that it creates a chronic inflammation of airways, hyper responsiveness to allergens and cold air and stress, bronchoconstriction and excess mucus production, and it leads to wheezing and coughing and breathlessness. So in this way, we have seen that how asthma affects our body functions. Evidence-based benefits of yogic practices. So we see that when we practice yoga, meditation, breathing exercise, mudras, and follow some spiritual ethical values, then they help us to improve FEV1 and VEFR in clinical trials, reduced reliance on bronchodilators, and enhance quality of life and symptom control, and lower anxiety and improved autonomic regulation are also the benefits which we can get by the yogic practices. Yogic physiology, how yoga affects our body systems. So we know that when we practice breathing exercise or Anulom Vilom breathing or Nadi Shodhan breathing exercise, so they help us to improve the oxygen exchange by diaphragmatic breathing process. We learn proper scientific or diaphragmatic breathing through all these practices, and we improve oxygen exchange. This yogic physiology also stimulates parasympathetic nervous system. If we have problem of hyper responsiveness, so we can calm down, and for that it is needed that we have to pay attention how the parasympathetic nervous system can be active and work in a balance. And it also enhances vocal tone and reduces inflammation and promotes calm rhythmic respiration. So these are the benefits, or you can say physiological changes, which we find by practicing all this yoga postures, mudras, breathing exercise, and mantra meditation. Now you see that there are certain important physical exercise for asthma especially. So the first is Bhujangasana, which is known as Cobra Pose, and it opens the thoracic cavity. You know better how this Bhujangasana is done because you have already practiced so many times. So here the posture is given and all the instructions are given. Just we can see that how we can lie down on stomach and can raise our body from front, or you can say from upper part up to the navel, and we can see towards the sky. So that helps us to open our thoracic cavity. Matsyasana is a fish pose, which you have also learned and practiced so many times. It expands chest and lungs. And there is Setu Bandhasana. You have here the exercise is given with all instructions. You can see Setu Bandhasana. So this particular exercise enhances circulation and lung perfusion. So these all are very important practices, is physical exercises which are very important for management of asthma. And there are certain other exercise too. Tadasana can also help. Uttanpadasana, which is known as raised leg pose, and Simhasana, that is also very important for asthma and for throat problem. Now, what is contraindications? So we have to be very much careful of all these things when we are practicing physical exercise. So here we can see that we avoid somebody who has some problem, asthma attacks. So acute asthma attacks, then he should avoid all these postures. Modify poses for elderly or weak patients. So we have to be very much careful about the patients who are weak and who are in old age. Monitor for dizziness or breathlessness. So we have to be careful if we are in that condition. We have to be careful about doing such exercise. Emphasize safety and personalization. So yes, it is necessary that we have to inform the practitioners or the participants or the patients that they have to be very safe, they have to be very much careful of their physical condition, personal physical condition, because the personal conditions varies person to person. There are some breathing exercises which we can also practice to control our asthma problem. So diaphragmatic breathing is very, very important. Deep abdominal breaths for lungs expansion. So if our lungs are strong enough and capable to breathe in proper way, then we would not have such kind of a problem, asthma problem. So it is necessary that we have to learn diaphragmatic breathing, that is scientific breathing or complete breathing, and we have learned about it, that how we can take long and deep breath by using the abdominal muscles, which is diaphragm and lungs and collarbones. Anulom Vilom Pranayama is also very important. It balances left-right nostril flow, calms mind. So it is necessary for the asthma problem that they have to practice, especially the Anulom Vilom Pranayama and the Bhramari. Humming breath reduces anxiety and improves airflow. So Bhramari, these all are very simple breathing exercises or breathing techniques which can be adopted by anyone or everyone. There is no such harm and no problem or difficulty. those who have some other issues, because of that they are feeling some thing, then they have to see that which pranayama is more suitable for them, or how they feel comfortable with all these practices. Now you see mudras. Mudras are also very important. You can see the mudras for respiratory health. So there is bronchial mudra. So we have learned so many mudras, but there are so many other mudras too, and pertaining to different health issues. So here you can see there are some new mudras, though some of them we have learned, but just one we have learned, but not all the other two. So bronchial mudra, it relieves bronchial constriction, and for that we have to uh, use the last one you are pursuing here, keeping the index finger straight, touching the tip of the middle finger with the tip of the thumb, and other two fingers should be on the base of, or on the upper part of the thumb, on the base of the thumb. So this is the mudra which is called bronchial mudra. If we can practice this mudra, then it will help us to relieve bronchial constriction. Pran mudra is also very important. It boosts vitality and lung energy. So pran mudra is already we have learned. This is a very simple mudra. We have to touch the tip of the thumb with the tips of the ring finger and the little finger. Asthma mudras. You can see that there is a special mudra for asthma problem, and it eases breathing difficulty. So you are perceiving here that just the middle fingers, the nails of the middle fingers are meeting with each other, and the other fingers are straight. So this is the this is called what we say asthma mudra, and it helps to get rid from asthmatic attack. It protects the respiratory system from cold, cough, colds, and stillness. The asthma, what we say, Hasta Mudra activates the points in the palms and fingers that are connected to the lungs and chest. So you can see that here just it is shown that both the nails of the fingers are meeting with each other, but you can also take these middle fingers in the center of your palm, and it will place those points which help us to come out of this lungs problem and chest problem. There are certain mantras, but I'm referring only the one which is very simple and everybody knows, and all our Indian cultures are practicing this mantra a lot. So this is very famous mantra, you can say. So here Om chanting. So it resonates with a parasympathetic tone. So we have seen that if there is the problem of hyper responsiveness, to control that problem, it is necessary that we have to activate the parasympathetic system, nervous system. So Om chanting resonates with parasympathetic tone. It reduces stress and anxiety and enhances respiratory rhythm and focus. So this simple mantra can be done by anyone. There are certain spiritual practices which are discussed in Jain tradition, and the first and foremost ethical value is ahimsa, that is non-violence, and it promotes mindful living. So if we are mindful enough, we would not have many more problems, whether it is mental, physical, or emotional. Okay, so non-violence is always what we say value which should be followed by anyone and everyone. Breath awareness central to Jain spiritual practices. So breath awareness, perception of breathing, we have learned already and we have discussed about it. So that that teaches us, or we learn that how we can take complete scientific diaphragmatic breathing, long and deep breath, and how we can enhance the capacity of our lungs, which has the capacity of 6 liter breaths in it in a one breath. So that kind of breathing capacity can be developed by perception of breathing or breath awareness. And in Praksha meditation system, we combines ethics, breath, and awareness. So we are not just learning meditation and yoga, but ethical values are also very important to follow with yogic practices. So we have discussed about perception of breathing for mindfulness, and there is color meditation also for emotional balance and integrates ethics, awareness, and healing. So these two meditations are not just meditations for a spiritual pursuit, but they also have some ethical. They have also power of healing. So awareness and healing and ethics all go together when we are completely focused and doing all these practices in a proper way. Lifestyle integration. So if we think about it, then we find that a vegetarian diet aligned with Jain values is very, very important for controlling so many health issues, including the asthma. We will not take any such thing as any wrong thing which creates asthma in us. So if we are clear that how we can vegetarian diet especially is based on the Ayurved system, and if we are following the Ayurveda in a proper way, then automatically we would not have such problem, because in Ayurveda it is said that how you can how you can take a proper diet, balanced diet, and according to the season or weather you have to eat something. So that is very important to learn through Ayurveda, that what is the right food in particular season, in particular weather, and also in particular condition of health. Okay, what happened to it? 1 minute. So we have seen that how, sorry, what is happening? So lifestyle is very, very important. If our lifestyle is up to the mark and according to our health, so we can be free from all these asthmatic attack and any other health issues. So vegetarian diet is very, very important, which is based on the Ayurveda, according to the need of the body, according to the weather, according to the season, according to the geographical conditions, and based on plants and herbs, which have the medicinal properties. So we have to be very clear that what kind of diet we are taking. If it is vegetarian and based following the Ayurveda system, then we can be free from such kind of problems and health issues. Regular sleep is also very, very important. People are not sleeping on time and not waking in the morning on time, and that's why their whole lifestyle is completely what we say messing up, and they are not doing things on proper time. So we know that our body is a kind of machine, but the machine needs fuel on time. If you are using that machine without putting the fuel, then how long it will work? So similarly, our body has particular needs in particular time, but if we are not sleeping on time and waking up, then we are not also able to fulfill the basic needs of our body, and sometimes that body system gets affected adversely because of our wrong lifestyle and having no regular sound sleep. So it is necessary that we have to take sleep or nap on time. We should not just go on working and working without taking care of our rest and also our body conditions. And daily routine, our daily routine should also be up to the according to the need of our body, or according to our health requirement. And if we are keeping all our routine according to our health, and if we are health conscious enough, automatically we will be very much disciplined our daily routine. Stress reduction through mindfulness and ethics. So it is necessary that if we want to reduce the stress, we have to be mindful in our own actions, behavior, emotions, events, circumstances, and any other situations. So our mind would be more calm and cool and can get a right solution to our problems and issues. So it will not create any kind of a stress in us. And ethics is very, very important. If we are following the ethical rules and regulations, we are not breaking any legal rules or social rules or any organizational rules, we are not going against them, then we would not have that much stress and anxiety in us. So it is necessary that we have to be ethically very, very strong. We have to follow our religious values, and moral values, other organizational values, social values, and also legal rules and regulations. So if we are following, then there is no such condition in which we will be more stressful and we would have any kind of anxiety in us. So if we are mindfulness, we would have the capacity to find out the solution to our each and every problem, and we would not be engaged in unnecessary things which create stress in us. So in this way, lifestyle integration is also very important to control the asthma problem. Since we have seen that most of the health issues are because of the stress. If stress is controlled or reduced or at zero, then there are so many other health issues, they can automatically be controlled. So in this way, we have learned how yoga can help us to come out of the problem of asthma, or how we can learn the management of asthma with the support of all these yogic practices. So with this, I would conclude my talk saying that how we can follow a clinical protocol in which we can practice at least 5 minutes diaphragmatic breathing, 5 minutes gentle asanas which are suitable for your body conditions, and 5 minutes mudra and plus om chanting, and 5 minutes Praksha meditation, color meditation, or perception of breathing, or mindfulness, that is called a bhavakriya. So all these meditations, so just a 5 minutes if we can sit, you will say that so many meditations we are referring all the time, and one person cannot do all, but we are not referring for one person only, and all the meditations are not for all of you, but those people who are having such kind of a problem and issues, it is for them especially that they have to practice at least 20-minute clinical protocol for dealing with that problem of asthma. So now, in summary, we can say that yoga and Zen practices support asthma management, emphasize safety, personalization, and consistency, and integrative. It offers integrative approach, enhances clinical outcomes. So thank you very much for listening to the talk. So anybody has any question?
So how much the all exercise will help to the asthma patients means how much they feel relief. Do we have any studies or anything available, or?
I think Dr. Devendra has presented that study. Just I have to look at those kind of studies. I could not see them, but just I can say that one example I have given in some other day, that one lady had a very hyper asthmatic problem, and she could not get any treatment from anywhere. So then she started practicing this breathing exercise, Anulom Vilom, Pranayama, Bhastrika, and Kapalbhati especially. So, or maybe Bhramari. So for 15 minutes she practiced all these 3 pranayam only, and for 3 months, and she has come out of that problem. Okay, so just I'm giving one example, but yeah, there may be more studies on it, and Dr. Devendra would say if he knows, or Dr. Naina has knowledge about the studies, she can say about it. Okay.
वंदामी नमस्ते समनी जी, आप सुख साथ में हैं? It's good to see you, Samni ji. So I'm just actually, I don't know about the studies myself. I just was reading the notes I took in Devendra's talk, and he did mention a study showing that doing the asanas and practicing the pranayama, which Samni ji is saying, the deep breathing, and Anulom Vilom and Bhramari, 30 to 60 minute sessions 3 times a week for 8 to 10 weeks. It showed improvement in their breathing, the peak expiratory flow rate, which is how well you can breathe out, because in asthma you have a problem with the breathing out, and it also increased your lung volume. So that was with the breathing and doing some key asanas. It was the bridge pose, Samniji Bola, a bridge pose, and the cobra. And then they also mentioned sun salutation and seated twist and cat and cow. I'm not sure how many of those poses they did, but they were doing it for 30 to 60 minutes, 3 to 6 times per week. I think I like Samniji, your protocol, that it's 5 minutes of each of those, which is 20 minutes every day. If we did that, I think that would be really good, because then it's much more consistent than doing it just 3 times a week. But they were doing even to 6 times a week. So that was one of the studies. I don't know any other details of it, but I just took that note.
Yes.
Samniji, I wanted to ask you about the mudra. This mudra, the asthma mudra, where you're keeping your fingers bent, only the middle finger. Then the palms are touching for the points, for the palm.
Yeah.
Okay, so you touch the palms and keep the middle fingers bent.
You can do that, but just in mudras, it is shown just you have to meet these 2 nails.
Just the 2 nails. Okay.
Yes. So the mudra is showing like this, but go into some detail and that how it is done. So I will share some articles if it is there, so you can see all the details in that.
Sure. So when there's a breathing difficulty, if we did this, it might help with easing the breathing difficulty in an acute attack.
Yes.
Yes. Good.
Sometimes the middle finger goes So this is also very important. This point, okay.
The middle point of, okay, put the middle finger on there.
To come out of mental anxiety.
Yes, you press this.
Yes.
Yes, because you start panicking.
Your brain can be relaxed, so automatically the problems will be solved.
Yes, breathing gets less. I think anxiety is a big thing.
Yeah, yes, so where the middle finger goes and
touches. Okay. Thank you, Samniji.
Yes. Any other?
I think Anita had a question. I think she came up while I was talking. Do you have a question, Anita?
No. I just was about the mudra only. So
okay. Okay.
Yes. So these are small things, but we can do anytime. It is what we say, no expense, without cost. All the treatments are in your hands.
Right.
Okay? In your legs or in your hands. Okay? Just one thing I want to show you. So here. And there is a small reels, but just they are showing all the points of our body in the legs. So it is said that all the points are available in your fingers or in your legs, or you can say in the ears. If you praise all these parts of your body, the whole body get nourishment, or what we say, exercise. So just I'm sharing that one. Okay, what happened? Sorry. Once again. So acupressure points are very, very important. We have to note down those points too.
This might be an ad, Samniji, so I think you may have to fast forward the ad.
Oh.
Exit from there.
Okay. It may
Looks
be
like
just
it's an ad.
Let me check once. Okay. Yeah,
okay.
It may be like this.
No,
just I have to check. Just you can see how the whole body, all the organs are connected with your legs. So where you can praise what organ can be treated. Is it clear? Here is the brain, here is the eyes, here the ear, bronchioles, lungs, and all other organs. So they all are found in legs, in the hands, and also in your ear. Okay, so this is what we have to see that.
That's a nice image, Swamiji.
It was really very important to note down all these points, and just by placing the points, we can treat many more problems. So now Ramesh Parmar is already here. I would request him to start his session.
Nami
Thank you,
Namaskar,
Anulom.
Swamiji. I just want to share one piece of interesting information.
Okay.
So in the latest issue of, I don't know if you can see this. Can you see this?
Once let me. Yeah.
So this is the latest issue of one of the magazines that comes, and it is on diabetes this time. And what this says about lifestyle changes is exactly what you're teaching also. So I'll just read one very quickly. Nearly 1 million Americans have tried the NDPP program, which is a lifestyle change, a research-proven, insurance-covered, drug-free lifestyle change and weight loss program. In a landmark 2002 study, the program lowered diabetes risk by 58% for people with pre-diabetes and by 71% for older adults. Modest weight loss, losing 5 to 7% of the weight. Modest increases in physical activity like walking 30 minutes 5 times a week, and limiting saturated fat while eating lean protein, fruits, and vegetables lowers risk for diabetes. So it doesn't define the physical activity, but all the yoga, the breathing will fit right here.
Yes.
With the physical activity. So I thought it was interesting. And there's a big article, and all the Dr. Devendra mentioned about CRP and other things. They're all explained in this article very well as well, the proteins and the physiological effects.
Okay, so it is available publicly, or we have
this is
private?
Right. This is an AARP magazine that comes out weekly, I think, or monthly. So I think
so you have to keep it safe, and whenever you come, bring it.
I'll bring it to the center next time I come.
Yes.
And Ramesh, if you can share that what is their magazine name? I think I can find it out online and download it later.
Yeah, this is called AARP Bulletin. I don't know.
AARP Bulletin, right?
Yeah.
Yes.
And edition?
This is the latest edition.
They might say January, February or something.
January, February 2026.
Okay, Feb 2026, right? Okay, perfect.
So you have
I'll place this one into our WhatsApp group.
Yes.
So we have to keep these informations in our record, so that whenever we are discussing these kind of things with our participants, we would have updated knowledge about the things.
Right.
Yeah.
Thank you.
Thank you.
Good morning, everyone. Jai Jinendra.
Yeah.
Let's have fun today. You have been sitting, so perhaps we can do some stretching, and then we'll focus on the asthma-related asanas, primarily chest opening asanas, right? Asthma is about the lung area, so we'll try to see what postures we can do. We went through the presentation, but we'll do the actual practice together. So let's, before we do that, let's try to stretch. And also at some point you may need a chair, but let's do without the chair. Are you able to see me completely? We can just start waking our body up. Find a comfortable, you must have your yoga mat. So change your posture, position, come to the yoga mat and start twisting around the waist, making circles, making bigger circles, twisting right and left, and start tapping, waking your body up, the legs, thighs, calf muscles, ankle, feet, coming back up, thighs, hips, abdominal, mid back, upper back, shoulder blades. And let's do bring the shoulders to the ears, make a fist, and exhale, bring it down. Shoulders to the ears and down, here and down. Let's do Tadasana, because Tadasana, as we saw yesterday, and for various ailments, diabetes, asthma, this is such an important pose, and it's a simple pose, but we want to do it right? Interlace your finger, you're standing flat, both on the balls of the foot, balls of the feet, as well as the heel. And then interlace your finger, inhale and stretch up, stretch up, inhale, and now come on your tippy toes. Engage your legs, your core. You'll maintain your balance if you engage your core and legs. Really strengthen your legs, the quads and the calf muscles. Really tighten that up, tighten the core. Do it one more time. Interlace the fingers in an opposite way and stretch up and tighten the whole body, particularly the core and the legs. And continue breathing. Breathing will also help you to maintain balance. And release, relax. Anytime you have any question, don't interrupt about this pose or any other pose. Let's start with sun salutation. Always before we get into the ailment-specific postures. Front of the mat, center of the mat, all must be very familiar. So make sure you continue breathing only in one place. Retain your breath, otherwise breathing continues. Inhale, exhale, prayer pose. Inhale, stretch up, arch back. Exhale, forward bend, palms on the ground. Inhale, right leg back up. We are ready to take a sprint. Look up. Inhale, prana, energy. Hold the breath, other leg back in the plank position. If the plank is hard, you can put the knees on the ground. Exhale, whole body except hips in the air. Inhale, cobra, pushing the shoulders away, smiling. The hips are on the ground. Exhale, inverted V, walking in place. Push your hips all the way back. Your head comes close to the chest. Your hips are all the way towards the ceiling. And you're pedaling in place. And feel the stretch in the calf muscles, the ankles. Left knee on the ground, right leg comes forward. Look up. Inhale, prana, energy. Exhale, other leg forward, left leg forward. Inhale, stretch up, arch back. Exhale, release. We are going to do the left leg. Then we'll add the variations after. Let's take a couple of more rounds. Inhale, exhale, prayer pose. Stretch up, arch back. Forward bend. Left leg back. Retain the other leg back. Lower the body, exhale. Inhale, cobra. Exhale, inverted V. Left knee, right knee on the ground, left leg comes forward, look up. Exhale, the other leg forward. Inhale, stretch up, arch back. Exhale, release. Let's bring up some variations. We will bring the crescent moon variation in this one. Inhale, exhale, prayer pose. stretch up, arch back, forward bend, right leg back, look up, straighten the body, both the palms together in the prayer pose, stretch up, arch back, look up and continue breathing. Maintain balance. A good, fantastic stretch opening, back stretching. Both the palms on the ground, other leg back in the plank. Exhale, lower the body. Inhale, cobra, pushing the shoulders away from your ears. Exhale, inverted V, walking in place. Left knee on the ground, right leg comes forward. Look up, straighten up, prayer pose. Stretch your hands, arch your back, and breathe. Maintain balance. Feel the stretch. Exhale, both the palms on the ground, other leg comes forward. Inhale, stretch up, arch back, release. Let's do it on the left-hand side. Inhale, exhale, prayer pose. Stretch up, arch back, forward bend, left leg back. In the prayer pose, arch back, crescent moon. Both the palms on the ground, other leg back in the plank, lower the body, cobra, inverted V, walking in place, right knee on the ground, left leg comes forward, stretch the hands above ears in the crescent moon, and breathe. Both the palms on the ground, right leg forward, inhale, stretch up, arch back, release, relax. We are going to do twist. Now we're focusing more on chest opening. So let's incorporate the twist. Okay, we're going to start with the right leg. Inhale, exhale, prayer pose. Stretch up, arch back, forward bend, right leg back, look up, straighten up, prayer pose. Take the right elbow, plant it on the right thigh, not on the knee. Look over your left shoulder and breathe. It's maintaining balance, opening chest, twisting your back. Both the palms on the ground, other leg back in the plank, lower the body, cobra, inverted V, walking in place, left knee on the ground, right leg comes forward, look up, left elbow on the right thigh, looking over your right shoulder, and breathe. Maintain balance and breathe. Both the palms on the ground. Exhale, the other leg forward. Stretch up, arch back, and release. Let's do it on the left-hand side. Inhale, exhale, prayer pose. Stretch up, arch back. Forward bend. Left leg back. Look up. Straighten up. In the prayer, left elbow on the right thigh. Look over your right shoulder and continue breathing. Both the palms on the ground, other leg back in the plank. Lower the body. Cobra, inverted V. Right knee on the ground. Left leg comes forward. Look up. Prayer pose. Right elbow on the left thigh. And look over your left shoulder. And breathe. Exhale, the other leg back, other leg forward. Inhale, stretch up, arch back. Exhale, release, relax. Look, we did 3 rounds of sun salutation already, 3 on each side. Relax, lie down on your back. Palms facing up, legs shoulder width apart. These breaks are very important when you're doing your own practice or when you're working with someone. It gives the body, first, the heart rate to come back to normal. Second, opportunity for all the lactic acid that gets generated when you strain your body for it to get accumulated. And let us start let's do fish pose, right? Chest opening. So remember, chest opening. So we are going to do fish pose. Bend the leg, bring both the hands under as close to each other as possible. The weight will be on the elbows. You straighten the leg, lift your body up, look at the toes, open the chest, plan the top of the head. No weight though, and your chest is open. Om 1, 15 seconds. Breathing only through your nose. Lift your head up, look at the toes, slide down, relax. Again, there are various variations of fish. You could use a bolster under your torso. You could fold the legs. So again, start with a classic simple posture, and then add variation if needed. So let's, while we are relaxing, let's talk about bridge pose. Again, bridge has also a lot of variations, but we start with classic, and we gradually add some variations. So in the bridge, the weight will be on the arms, and the core will be tightened. Don't tighten your neck or face. Okay, be very relaxed. And of course, the legs also will be participating, and they'll be also taking the load of the body. So both the legs, both the hands close to the body, and lift your hips up. When hips are up, you can bring both the hands closer to each other, shoulder blade towards each other, lifting your hip up and interlacing your finger. Keep going as high as you can. Continue breathing. Don't tighten your neck or anything. It's a relaxed part of your body because you're trying to open up the chest. So this is the one part. Now you could support the lower back with the palms of both the hands. So your bridge is much higher, right? This way. You good? Everyone good? If you're not good, interrupt me. And then when we are here, feel comfortable, go ahead and straighten your right leg. Still the bridge is supported. Bend the leg down, straighten the left leg, and down. And with control, we come down. And straighten the legs, relax. If you're suffering from any back pain personally, you could actually use the bridge pose. Start with small bridge because you're building the back muscles as well, and keep raising your torso up. Fantastic for strengthening the back as well as the core. The bridge pose.
Is the weight on the elbows mostly?
The weight in the bridge,
Yeah.
Arms are taking it, so to feel it. See if you feel. So both the arms are taking the weight, and your core is also, you're tightening it. So that way it is strong, so it can go higher and higher. There is no weight, let's say, on your neck area. So your legs are part, so it's evenly distributed, I would say. The arms as well as the feet. Your core is also strong, your quads are strong, and you can come high.
A little bit of pressure is on my back. I have a weak back, so I was just trying to, yeah.
So a weak back, what you could do, good idea. Let's go ahead and I have this block. Go to the lower setting, right? The lowest setting, very flat. Okay, this is a good way. So what we are trying to do is I put it just at the bottom of my back, lower back. So the spinal cord will have a chance to relax as well and try to extend. Okay, so now I'm not supporting, but this is a good, I'm getting a simple stretch. Now I can handle it, let's say, then put it to medium setting. Once you do the medium setting, you can straighten the legs, straighten both the hands above your head. You can feel, okay, my lower back is getting stretched. I'm feeling good. Again, exercise caution, every condition is different, but this is fantastic for stretching as well. You feel comfortable, you feel good. You may want to try on the largest setting, which is keeping it vertical. You need to have a cork block. Mine is not a cork block. That will go the bridge higher. So that way, you're giving your arms a break as well. You're focusing more on the back. It's a back specific pose as well.
This definitely helped a lot, the block.
Yes, absolutely.
Yeah.
Because then you're freeing up. The weight load bearing is your arms are free.
Yes, thank you.
Sure. So let's, we have done that. Let us come to the Asana, because that's also very highly recommended for many ailments. So the palms are under the shoulder, the knees are shoulder width apart, and you're looking up and breathing in, the back is arching down. Exhaling, you're looking down, the back is arching up as if your navel is touching your back. This is also good for back issues. This is a preparatory exercise for spinal twist. Okay, we have done the Asana. Let's do, we are seated, so let's do half spinal twists, right? We'll sit on the left hip, left side of the body. Right leg is on the top. Right leg is vertical. And I can just, in the posture, if for some reason, if my legs are not helping me out, I can just use both the legs on the ground and just twist. Creating, the idea is to open the chest, right? We are working with asthma. We're trying to open the chest. Okay, so this is a good start. But if the person is flexible, more flexible, you can straighten the leg vertically, plant the right hand, plant the left hand outside of the right thigh. You can have the palm, the lower arm vertical, and look over your right shoulder. And keep every exhalation, try to go even twist by extra millimeter and lengthen. And release. Do it on the opposite side. I can go ahead and let me change the side so you can see it. I'm seated on the right side of my body, and both the legs are bent, and I can support my my right hand is supported on the pushing, kind of pulling my left leg, and the left hand is pushing. So trying to create a counterbalance and straightening my chest area. Okay, the person whom you're working with, they're quite flexible. Okay, let's go ahead and do it where the left leg is in the air, right leg is bent, straighten up, twist. Take the right hand outside of the left thigh and twist. And keep breathing. Every exhalation, you're going taller, and every inhalation, you're also twisting a little bit more. And release, relax. While we are seated, any question on half spinal twist? You can do this on the chair as well, as we have done before.
I would just say it's important to stretch before you twist, right? Pull your hands up as if, and then stretch and then turn around. Just keep your body straight.
Your back, the torso has to be straight. So that's why you don't have to have the legs in the air. Both the legs are bent, right?
Right.
And then I can twist my torso. Now I'm seated on the left side. My right hand will go behind the back, and left hand is resting on my right knee, right leg, and I can twist. This is much, much simpler, easier. Idea is the chest opening up, and this helps in chest opening up. We change the side, same way. Also bend towards the left, plant the right hand on the left leg, the left hand being planted behind, and then create a counter motion where the right hand is pulling my left leg and left hand is pushing away, creating counter motion so that my chest can be as straight as possible. While we are seated, let us do sitting forward bend. But before that, let's prepare it, right? You sit in the butterfly pose. The toes and heels are touching each other. You're sitting tall. Grab hold of, interlace your fingers, or just one set of fingers on the other, and then get into the butterfly. The idea is opening the hip. See, the knees can touch. Visualize to realize. May not be there today, depending on where we are in our practice, but we'll get there. And now, keep coming down. Bring your head, your nose to the toes. If that's all you can do today, fine. But every exhalation, visualize that you're coming down even by 1 extra millimeter. Release, relax. Now we have kind of opened our hip a little bit, so now we can see if we can do a Paschimottanasana, sitting forward bend. Both the legs straight, legs together. Stretch both the hands in the air. Straighten your back, and your hands are stitched to your ears. So when you bend from your lower back, it's going with the head. And let the hands fall wherever they fall. It may fall on the toes, the ankle, calf muscle, wherever they are. And just breathe. And visualize that every exhalation you're coming down, even a little bit. Relax your body. Don't make your upper body very strict, very stiff. If you relax it, it will listen, it will start bending. That's the natural law. The gravity will attract it towards the ground. Over a period of time, the torso will be almost parallel. Continue breathing. And release. Anytime we do right side, we do the left side. When we do forward bend, we do the backward bend. So we are going to do the inclined plane also, right? Did the forward bend, we'll do inclined plane as a complement. We straighten the leg, plant both the hands behind your back and lift your hips up. Again, if you have a back issue, you may don't have to go all the way up. If you can't even go, that's fine. Just put the hands behind you and look at the ceiling. Good starting point. Lift a couple of centimeters from the ground. And if you're strong enough, keep going higher and higher and higher and higher. And so focus has been on chest opening asanas. Let me see what else is open from the list that we covered. Downward dog. And we have to do the on the tummy. So let's do the postures on our tummy. Cobra, bow, and downward dog. Okay. Are we doing time-wise? Okay. Cobra, right? You can rest your one side of the cheek on your personal pillow. Pillow is both the palms on the ground, one over the other. And fantastic to confirm whether you're breathing properly. Nobody teaches us how to breathe, but sometimes people do breathe incorrectly. Inhaling, the tummy pushes against the ground. Exhaling, it goes away from the ground. Forehead on the ground, both the palms close to the shoulder, legs together. Come up. And if come up 2 inches and smile, a baby cobra. Down. And if you do have a challenge with your wrist, you can put both the lower arms on the ground and then come up. Chest is open. That's the idea. The weight is on your elbows and your lower arm. If you feel strong enough, both the palms on the ground, close to the shoulders, and come up. Make sure hips are on the ground. And come up as high as you can. And keep smiling without creating any tension, any stress in your face. And continue breathing. And release, relax. You could add one more variation to the cobra. We have a three-legged Bhujangasana, where you rotate your head towards the right, towards the left, right? Which we have done that, right? Center and towards the right, looking back behind towards the legs. And come down. Other variation you can do, come up in cobra, bend your legs. Those of you may be more flexible where the soles of the foot touch the top of the head. I'm not there. And release, relax on your personal pillow. One palm on the other, palms facing down, and breathe. While you're relaxing, visualize the bow. And that's how you're going to come up. Visualize to realize the bow. Forehead on the ground, bend the legs, grab hold of the ankle. So far, so good. Right? Now push the legs away from you, upper body will come up. Keep coming up as high as you can, and then no more. At that time, you can start massaging if you want, and creating a rocking motion. Release, relax, rest your cheek on your personal pillow, toes touching, heels falling by the side. And again, each of these postures, you could do it multiple times. In this session, we are doing not too many times, but when you're practicing for your own or working with people, if patients, you could actually do it multiple times. Now we will do downward dog, which we did in sun salutation, but here the focus will be just on the downward dog. So both the palms on the ground, right? The index finger is pointing straight north, and the elbows are in the back. Look at the elbows are in the back, right? And then I push with my toes, hips up in the air. The legs are shoulder width apart, and I keep bringing my head closer to my chest. And you may feel that, okay, I don't feel comfortable. Maybe you need more distance. In my case, I need a little bit more distance. So I take my legs further back. And the head is coming towards the chest. Chest is going, hips are going up in the sky, in the ceiling. The toes, the heels are touching the ground all times. The second toe is straight pointing in line with your index finger. You can start walking towards your hand palms. Bring both the legs inside the hand. Just hang loose. You can create kind of a swing where use the weight of the arms to bring your torso further lower. You may want to switch this, how you're holding the, I don't know what this posture is called, but this helps in basically you're carrying some weight, and that weight, the arms, the bent arms are like a pendulum. They're pushing you a little bit lower. Keep the knees straight. It helps. It helps in bringing you closer to the ground. And release and slowly come up. We can do the triangle as well, Trikonasana. The right toes are facing right side. The center of the left foot is in line with the right leg. Hands parallel to the ground and scooting to the right, which means the hips are moving left, right? And you want to make sure your right thigh doesn't go back. It's pushing forward. While you're leaning, that right hip is held strongly and it is not moving. Are you good with me? Make sure that right thigh doesn't move back when you're scooting, when you're bending. It is firm, right? The left hand is in the sky. You keep bending and pushing the right thigh towards the front so that its hips are aligned. And the left hip is going down and right hip is going back and right hip is coming forward. Maintaining alignment. And looking at the ceiling, chest is opened up. And come back. Same the side, but the left toes are facing the left wall, right toes are facing a little bit to the left, hands parallel, scoot to the left, tighten your quads, okay? Scoot to the left, bend to the left, right hand is in the air, keep bending, and make sure the left quad is strong, it's not getting pushed back, moving forward so that your hips are straight. Keep coming down. Keep looking at your hand, at the fingers of your hand. This way, your chest is opening up. You're not collapsing your collarbone area. And release, relax. Okay. Any questions before we move on to COPD related postures? These are different postures for asthma. We have the supported child pose, which is interesting. If you have a pillow, let's give it a try. Ideally, bolster would be best, but if you don't have bolster, get a thin pillow or a block where you put the block in between the legs, in between the knees. Because you think about it, what is happening, right? Some people are suffering from this asthma related, they may not be able to bend so far. So that's another reason why you are recommended to have a pillow between the knees, and then you come down as much as you can. This pillow is like a support, or make it a vertical, the tallest. Pillow will be the best, and so that the height is there to support the chest area. Relaxing, activating the parasympathetic, reducing the cortisol, all such various benefits are there. And if you don't have anything, then you make a fist and one over the other, and plant the top of your forehead on your fist. Okay, so that's the supported child pose. Legs up the wall. You have done it many times before. I don't have a wall, but you can just demonstrate it where the legs are straight. Again, here also the block could help, right? I lie down, lift my hip up, go ahead and put the block on the sit bone, and then lift my leg up. Relaxing, so the heart is getting a break. This is good to start, right? If you don't have the wall, if you have a block handy, this is a good way to get started. And then you're saying that, no, I feel comfortable, I can go beyond. Okay, let's go ahead and do Viparit Karni, where the torso is about 45 degrees and the legs are straight. Then the leg and come down, relax. Okay, we are going to do the postures on the chair for COPD. The COPD postures are seated mountain, right? You're sitting tall. Let me take. And stretch both the hands. Make sure the chest is opened up. The hands are by the ears. No point the chest should be collapsing. Don't become like this where the hands are really not helping at all and they're compressing the chest. But by the ear, behind the ears, this is good. The chest is opened up, back is straight, and release. Okay. The seated forward bend, again, seated tall, bend forward, and then come down as low as you can. If the palms are touching ground, well and good. This is good also if you have back issues. For example, this is good ways to get started, to get some stretch, much easier. Of course, we have practiced the seated twist many times. Sit on the one side of the chair, take both the hands above your head, rotate your torso, plant both the hands on the rim of the chair, and in this case, I'm sitting on the right side of the chair, so my left hand is pulling and right hand is pushing, so that my upper back is straight, opening the chest area. And I'm looking over my right shoulder. And release. Change the side. And sitting on the edge. Raise your hands. Twist. Grab hold of the rim of the chair. One hand pushing, one hand pulling. Creating a counter motion. Helping in bringing our chest as straight, as flat as possible. And release. Relax. Any questions so far? We have a few more postures. Just give me 5 more minutes.
Rameshji.
Yes, Akashji.
The Balasana that we practiced.
Yeah.
Just before this one. You taught the fist placed against the abdomen.
Oh, that was a frog pose. That is for diabetes.
Yeah, okay.
Very similar.
Okay.
We are not covering it, but just since you asked, you take the thumb inside and press it on both sides of your navel area and then bend forward.
Right.
That is for the diabetes, right? We are trying to get those organs massaged.
Okay.
Whereas in the Balasana classic, you can create a fist and to rest your head, or you can take both the hands, both the palms
straight back
next to your legs. Right? Just
okay.
Straightforward, right?
I thought you showed the fist also.
Oh, yeah. So the fist was to, in case if I don't have a pillow.
Okay, I misunderstood. Okay.
Yeah, in case if I don't have a pillow, this is one way to raise my head, my chest up.
Yeah.
And then if I do have a pillow, and then I can rest my forehead. My hands are next to my legs and palms facing up.
Right.
Or I could do both my hands forward as well.
That's the Shashankasana.
Complete Vandana pose.
Right.
This is what normally we will do.
Yeah.
And somebody who is constrained, let them use a pillow, block. Right?
Yeah. Okay. Thank you.
Good. We need to do a side stretch, right? Side stretch, where you're seated on the front part of the chair, seated tall, left hand close to left ear, right hand is hanging loose, and then bend to the right. Feel the stretch on the left side of the body. They may look so simple, right? But if somebody is so physically challenged with some condition, compassionately we try to adapt, compassionately show them how we can adapt and do it. And we may not be there on day one, but adjust, change, and then help them. So change the hand, right hand close to right here, left hand close to just hanging on the left side of the body, and bending to the left, feeling the stretch on the right side. The interesting thing about Rakeshji, about this supported child pose, we want the lower lungs to be exposed so that they can be used up. They are underutilized. So the lower lungs are exposed, so that way they can take in more oxygen, they can do their work by bending it down, exposing the lower lobes of the lungs on both sides. Cat-cow, we had talked about, remembering inhalation is 1 duration, exhalation is 2 durations while you're seated on the chair. So looking up, inhale, and looking down, exhaling. Inhaling 2 seconds, for example. Arching my back, looking up. Exhaling, looking down. 4 seconds, arching my back towards the chair. Looking up, out my back away from the chair. Breathing in for 2 seconds. Looking down, arching back towards the chair, back of the chair. Exhaling 4 seconds. It creates a good mobility. Someone who can't sit on the floor, you could also use this to help them. Okay. Then, of course, seated marching, right? One leg up. You can put the hands on your hips. Make sure you're not wobbly. Not wobbly. Keep the back straight. Engage the core. Bring the leg up as high as you can. You can ask them to go ahead and hold the leg. Interlace the finger, hold one leg. Of course, you can bring some changes that you can say or rotate by the ankle in one direction, other direction. What we do lying down, we are trying to do the similar things. Rotate by the ankle in both the directions. Release, do the same thing, engage the core, hold the leg, rotate the foot by the ankle in one direction, in the other direction. And then we conclude with the Savasana, where we go ahead and we are lying down. We are basically sitting on a chair in an inclined position and relaxing. Both the hands resting on your hips or thighs, and breathe and relax. Maybe a good idea to support your back with a pillow, with a wall, or maybe have a back that is long enough it can support your head. As research has shown that they do work, these postures, over a regular period, regular practice becomes part of the lifestyle change.
Rameshji,
yes, sir.
Chair relaxing pose. I have this wooden chair, and sometimes the plastic chairs would be the same. I think it might be important to emphasize or stress that we dig in our heels so that we don't slide. Like Shavasana. So we dig in our heels so that we don't slide.
Oh, the legs are always on the ground. Otherwise, you're wobbly and you may fall. Yeah.
Right.
Exactly. Yeah.
Because we can hurt our back if we did slide. Like this position, hands on the thighs, we dig in our heels so that we don't slide forward like that.
Correct. And also, head should be rested. You don't want to strain your neck.
Okay, how do we do that?
Get against the wall. Go against the wall.
With a higher back.
Taller back or against the wall. So the head is supported on the wall.
Good idea. Yeah, thank you.
Yeah.
Okay.
Good point. Anything else? I think we covered all the different poses for asthma as well as COPD.
No, very good session. Thank you.
Chest openers is the key. You're working with the lungs, so you have a hook for each ailment. You have a hook, right? Asthma is lungs, diabetes is pancreas and kidneys. So then you can get an idea. I don't have to memorize the posture. Okay, this posture will fit into this category, right? As we discussed yesterday.
Yeah, even in the Surya Namaskar, when you do the variation where you twist your spine, that could be good for your pancreas also, right? So you can mix and match once you know what you're doing.
Exactly. Once you know which part of the body you want to access, massage or stretch, then accommodate and bring the asanas accordingly.
And only thing I would suggest to everybody is that, we try and practice yoga as often as we can because we've got to be good at it. But when you're sitting, these chair yogas are very easy to practice. That'll keep you, even though you don't need it, but it'll give more yoga and more stretching. So I think this is a good thing to keep doing, even when you're sitting. Some of these poses you could do while you're sitting at work or wherever, where you don't have necessary space for a mat. It'd be good to keep it going.
A good idea. And actually, there are a set of 7 stretches on the seated. I mean, in terms of for asthma, right? The seated mountain, forward bend, you're flying, a long trip. You could do a seated forward bend, right? Assuming there's enough gap. Or you could do a seated cat and cow, not bothering anyone. Seated marching as well. So, yeah. Good point. Yeah.
Even twisting your ankle, raising your knee, and rotating your ankle, that'd be good for a flight. You won't get the problems about the flight and the clots. So it'd be a good thing to keep going.
Yes, the circulation. Yeah, the continuous circulation as well. Yeah. Okay. Any other comments, questions? Thank you so much.
Thank you so much. Very nice session. Thank you.
Thank you, Ramesh Bhai. Great presentation.
Thank you. You're welcome. Yeah, very good. We are going to take another disease for next week. Until then, happy practicing. Any questions, put it on the chat. Yeah.
Great. Thanks so much. Thanks, everybody. Bye-bye.
Thank you, everyone. Have a great weekend. Jai Jinendra. Bye-bye.